Do you ever feel that you don't get enough benefit from the time you spend stretching? This is a scenario we see frequently in clinic where people tell us that they feel stiff with certain movements, whether that's activities of daily living, bending to put shoes and socks on, putting their arms in a jacket, twisting and turning in bed at that level, or people who are playing sport that tell us that they feel stiff, that they feel that they could easily pull a muscle, usually a hamstring or a groin or a calf. So that's a pretty common scenario that one encounters clinically. And the question then is really why, if people have been doing stretching, why do they not see a practical benefit from this? And there are a number of reasons there involved with that I thought would be worth discussing today. The first thing to establish, of course, is whether there is a lack of actual movement. So if you find difficulty getting down to put your shoes and socks on, there are a number of different structures that are involved in that movement pattern. You need to be able to bend from your spine, your hip needs to be able to bend, your knee needs to be able to bend. So they are essential linkages in the system that need to be able to function. So when we examine those areas clinically, we can determine whether the movement in the joints and in the surrounding tissues is actually restricted. And that's very important to establish, because it's quite common for movements to feel stiff, not because you don't have the flexibility, but because the muscle strength is limited, and therefore weak muscles are working very hard to support and control body weight. And because they're working so hard, they feel really stiff and tense, but the actual underlying problem is a lack of strength. And that's really, really important to identify clinically, because the treatment strategy there is completely different from just doing stretches. So a proper systematic examination gives us some information whether, first of all, there is a mechanical restriction in the tissues. And I use that term generally because we need to break down where the tissue restriction is. Is it muscles? Is it tendons? Is it fascia? Is it joints? Is it nerve tissue sensitivity? So all of those different structures will influence and can interfere with movement if they're compromised or sensitive. So a proper examination needs to try to identify where the restriction is and what the cause of it is. So I suppose nowadays you see an awful lot of information online about foam rolling and soft tissue work and myofascial therapies. And of course, the important thing to recognize there is that those therapies are directed entirely towards the muscle tissues, primarily muscle and probably fascia. So if the restriction is in those tissues, which really you can identify from systematic examination, then those kind of treatments, whether they're performed by a therapist or as a self-directed treatment, are the appropriate things to try to do. And the question really is, well, if you are using those kinds of treatments and you're not really getting a benefit, the question is, well, why is that the case? One of the common things we see really is that the tissues that are restricting movement aren't the more superficial tissues near the surface, which a foam roller or a spiky ball or any of those kind of myofascial devices, which they can get at, but the actual restriction is in the deeper tissues, usually either the ligaments that surround the joints, the capsule that surrounds the joint, which is like a balloon-like structure, which is an integral part of most joints in the body. So working on foam rolling muscles and working on trigger points really is completely missing the point. Now, sometimes you'll have coexisting tightness in the muscles and coexisting joint stiffness. But if your treatment techniques are only targeting the muscle, then that is a common reason for not seeing enough change in flexibility. So if the restriction of movement is in the joints themselves, then usually that needs some combination of manual therapy to stretch and distract the joint in different directions to try and give more elasticity. And you can really only tell from physical examination and a trial course of treatment whether that's going to be effective or not. You'll usually know within 3 or 4 treatments whether various types of manipulative techniques are improving the elasticity of the joints, and that whether you're actually seeing a practical benefit in terms of more flexibility. So that's an important thing to establish. Now, on one end of the scale, if joints have got very degenerate, and where there's a lot of wear and tear, and that would be people in an older age bracket generally, or people who've done high intensity sport and worn the joints out fast in their 30s or maybe early 40s. What happens there with the joint is that not only does the joint surface become worn, but you'll get some extra bone formation around the margins of the joint, which can sort of pinch and catch in the joint, and also the capsular structures, what are called the periarticular structures, they can become leathery and thickened as well. And very frequently, clinically, depending on what stage or what where on the scale the individual is, if you get more elasticity around the joint, you take away some of the compression on the joint surface. And even if there is some wear and tear there, just by having more elasticity, you can reduce the symptoms quite significantly. However, if it's gone too far and attempts to try and restore mobility just cause pain in the joint, that's not a good prognostic sign, because it means that the joint has undergone significant change, and any attempts to try and to restore mechanics in the joint just end up provoking it and being counterproductive. And again, you will see that over 3 or 4 treatments maximum. But that's an important thing to establish clinically, because it means that that type of a treatment approach is no longer going to yield any useful results. But of course, it also means then that movement is now lost from the joint, and it's a case of then whether there's a surgical approach required, or can people manage and just try to adapt around it. But it means they're not going to get normal function back in the joint. So that's a very important thing to establish clinically with a certain cohort of the population with degenerative change. The other common reason, and probably more so in the sporting environment, where we see people feeling tightness, usually in the hamstring or the groin or the calf, and they may initially be stiff with movement, so they do stretches and warm-ups or stretches during games, which loosen the tissues off, but they still feel like they're tense and tight, and they want to keep stretching them. But when we examine them in clinic, we find that there's no actual loss of flexibility in those joints, or in the muscle, should I say. And that's a very important distinction too, because what we know is going on clinically there is that the muscles are tight because they are trying to compensate for other muscles which aren't functioning well. So the feeling of tightness that you get is not because of a lack of flexibility, it's because of a massive increase in tension in the muscle. And that's very important to identify, because continuing to stretch that won't make any difference at all. The solution there is really to delve deep to find out where the muscle imbalances are. This may be around the core, it may be around the hip musculature, it can even be lower down the leg in the calf and foot. So very important to identify if there are deficits in those regions, because just stretching tightness when there isn't a lack of flexibility isn't going to yield any useful results. Of course, there are a lot of other coexisting factors depending on the positions that you spend your day in. If you're predominantly sitting, then you can get adaptive changes. Our tissue elasticity changes with time, so typically over the age of 40, we certainly become less elastic, and the need to do counteractive stretches, depending on our activity levels or our habitual usage, that can require more input. Of course, there are systems of approach like yoga. Obviously, yoga is very much a flexibility focused type of regime, which is very, very beneficial. But of course, if you don't have the time to commit to a yoga class, then you could certainly do your own routines that are specifically structured for your movement directions. Because that's another thing we see clinically, where people say that they've been doing some stretches that haven't been very effective. But when we analyze what they've been doing, they're not stretches that are specific to the direction of movement that they're restricted in. So you can be a busy fool doing generic exercises that might stretch in certain directions, but they're not the directions of motion that you're restricted in. So that's a fairly common reason too, where we don't see as much benefit as one would like from specific stretching. And of course, the message here really is that one needs to really identify the underlying causes of what feels like movement restrictions or uncomfortable movements, because the treatment strategies are very different. And yes, there often can be a lot you can do as a home regime, but one needs to identify the correct things to be working on. So that's a situation we see on a daily basis in clinic, and I just thought it was worth sharing some of those thoughts with you. If you're in that situation where you feel your movements are restricted and not as fluid as you would like them, but you're not getting the benefits from the stretches that you've been working with. See you again in another video. Bye for now.